Following directly on that, I'm going to hand over to Roberto, who's going to share the expansion of a national approach in Mexico with us. Over to you, Roberto.
Buen día. Good day, everyone. Thank you for the opportunity. I'm going to present the case of Mexico regarding the national coordination on medical devices information for attending the COVID pandemic. Celtek stands for National Center of Health Technology Excellence. It's a technical unit from the Ministry of Health in Mexico that supports health technology management and assessment needs all over the health system. We are also a collaborating center for WHO and PAHO, and we collaborate on national policies and strategies for health technologies, including data management. We have a clinical engineering area that, among other things, helps in precisely data information on medical devices, particularly medical equipment. For national health system, it's a segmented one. We have 7 independent public or social health service providers, obviously along with the private sector. And this certainly represents a big challenge when it comes to coordination and to establish national policies on whatever issue we have with health technologies. Also, each of the 32 states that compose our country have their own Ministry of Health with their own independence, and that also is certainly a challenge, again, regarding the coordination for several strategies. But obviously, the Federal Ministry of Health, the Central Ministry of Health from government oversees all the national health system. And they remind that Celtek belongs to the Ministry of Health. So when a pandemic struck us all, what happened with the coordination for gathering of information on oxygen therapy devices or other priority medical devices to attend COVID? Certainly, it took us all out of base, and we have several problems in coordinating, in proper coordinating to gather information, and Mexico was not an exception. Anyways, the Ministry of Health started to gather information for priority medical devices. The problem here is that, as I believe it happened in all of the places of the world, they didn't approach to medical devices management specialists as clinical engineers. And that represented certainly some problems in order to find the proper information. And Mexico, again, was no exception. So the Ministry of Health presented information on total medical devices. We can see here a chart where medical devices such as hospital beds, ventilators, monitors, X-ray units, etc. And they presented the total of each of these devices by the public health providers. And here is the total. Celtek was not requested to help in this information, and something that we think that represents a problem is, first, that we are not sure if the totals were correct and where this information came from. But one of the main problems is, and let me take the example of ventilators. Ventilators, we have here the total. It says here that nationally, at least for public system, there were around 5,000 ventilators, but we don't know what type of ventilators are these, and also their service condition, if they are working or not working. Regardless, the Ministry of Health started with this information and with some calculation on what the demand of service to attend COVID patients would be needed. They started to buy ventilators. And here came another problem. What type of ventilators we are going to get and with what technical specification? Again, Celtek didn't get invited in the first steps. He was certainly invited later on, and we helped establish some technical specification, but in some cases, this proved to be late. So one problem that we're going to have is that once that the pandemic recedes, what are going to do with all the ventilators or other medical devices that are not going to be used anymore? So this is also a challenge that we have to look at. This is a sort of the bad news. The good news is that the Ministry of Health has a proper information system for all the resources that we have in our national health system. We have this web page. Here's the link. We have a web page where we can see how many hospitals are in the country, how many health personnel we have, what and what number of services we do have, etc. And one part of this system is for medical equipment. Unfortunately, right now, the information available for medical equipment is just for high technology equipment, meaning that it only reports linear accelerators, mammography units, MRIs, tomography units, labs, nuclear medicine units, and other radiotherapy units. But it sorts the information for the type of health of public health provider. I mean, it has a good information, and for this information, Celtek was part of to construct this information. So this can prove that if we have a proper coordination, we can have valid information. How we do it? And this proves the importance of having a clinical engineering unit that can be the link between the stakeholders that are in responsibility of gathering information for medical devices. We help in the coordination with all the health providers from the 32 states all around the nation, the country, with the technical unit from the Ministry of Health that is in charge of these information systems. We help in establish the information that is needed for a national inventory of medical equipment. For example, brands, models, but most importantly, the service condition of the medical equipment. We help in education and training, and in establishing guidelines for those purposes, etc. So this has proved that it can be useful and helpful for having a proper and valid information on medical devices. So what are the lessons learned and what are the things that we can do better? First thing is that we have to keep on having awareness on the importance of medical equipment, on a proper medical equipment inventory that includes service condition. If each medical unit has their proper medical equipment inventory, gathering information for national policies is going to be easier. So that's very important that we keep on working on the awareness of having a proper medical equipment inventory. Also, it's as you can see, we didn't find oxygen supply systems, like the previous presentation that we have. And because we didn't work on medical oxygen supply systems, when the second wave struck us, it was certainly something that we paid highly, because we didn't have a proper plan to for the cases where oxygen supply were not properly provided. So this is also teaches that we have to be aware of what are all the requirements for these kind of cases. And let's say that obviously WHO has helped us all with their very useful guidelines and priority list, because we can use now that. So it's very important to take into consideration other priority medical devices. And certainly we have to make better strategies regarding how to update the data that we have. Probably the Ministry of Health get the information that I presented in the first chart from databases that were not properly updated. So this is also very important, that all can have a proper strategy to update data. We know that medical devices during their life cycle have several changes. They change constantly, so it's really important to keep our data updated. And finally, information that doesn't help to solve a problem is information that is not useful. So let's not work on something that will take us, that will be a waste of time and efforts. And let's try to get the information, the proper information that can really help us in solve a problem. In this case, the attendance of COVID patients. So it's also important that we be better prepared on how and what type of information is really important to help in solve health problems. That's the purpose. That should be the main purpose of health technology management in the end. So that's on my part. Thank you very much for having me, and well, there are information on where to find me in case you have any question. Thank you very much.
Thank you so much, Roberto. That was such a good overview of the systems that you use to manage all of this information in Mexico, and really just demonstrated, it was a great case study of the sheer volume of information from different regions and different systems that you were trying to feed into a centralized system to get an overview of both the devices and the service state, which is so critical to be able to have equipment that's actually working where it needs to be, when it needs to be. So thank you for that